Hello, everyone. Welcome to Med School Moments. My name is Dr. Matthew Momjian, and today we're going to be discussing how you can enhance your standardized patient encounters in medical school. In this episode, brought to you by MedSchoolCoach, you will learn techniques to enhance your clinical examination and communication skills during standardized patient encounters. You'll discover how to receive and integrate feedback effectively and improve your future clinical performance. And you'll understand the importance of empathy and patient-centered care in clinical practice. So let's get started. Within the standardized patient encounter, one of your primary, really the main goal, is to demonstrate your ability to create and foster a physician-patient relationship. And what this means is that you need to present yourself and interact with the patient in a way that future patients are going to trust you and be willing to share details with you that will help you ultimately treat them effectively and help them get better. In order to form an effective physician-patient relationship in a fast-paced, short-term patient encounter, there are a couple of things you can do. One important thing you can do is to use active and reflective listening. And your goal here is to make the patient feel like they are the center of your attention and that they are being heard. So one example of a way you can do this is when the patient says maybe they're stressed about their job. An easy thing for you to say is, "I can understand you're stressed about your job. That must be really scary not knowing what the future is going to be there." Simple statements like this show the patient that you heard what they said and you've processed it and understood it in a way that at least attempts to understand what they're feeling. This is a way that you can show the patient that you care about them as a person, not just about their disease process or their chief complaint. You want to show a genuine interest in who they are as a person, specifically outside of the doctor's office. Another important part of the physician-patient relationship is building an effective team and effective shared decision-making with the patient. And to do this, you need to form a partnership with the patient. You want to make the patient feel like you are their ally, that you are on their team, and you're going to work together as this team to help address their concerns and get them feeling better. Of course, within the standardized patient encounter, you're going to want to treat your patients with respect, kindness, and empathy, just like you're going to treat your real patients. By making your patients feel cared and respected, you can start to work to gain their trust and build a rapport with them. Of course, a standardized patient encounter is not just about the relational components. You also need to show your ability to gather medical information about the patient. You can do this by asking open-ended questions. So instead of asking yes or no questions, like, do you have chest pain when you walk? You can ask a patient something like, how often do you walk? How far can you walk? What kind of feelings or symptoms do you sometimes get when you walk? This allows the patient to answer in their own words based on the experiences that they've had. You want to try to always elicit the patient's specific concerns and priorities. What brought them into their visit today to seek medical care, and what are the issues that they want to try to address? And of course, you want to understand how this issue or problem affects their quality of life. This allows you to identify ways you can help and counsel the patient, even in the short term before the symptoms are resolved. You also have to provide information and education to the patient. Physicians are a trusted source of medical knowledge, and you'll often be asked to convey this information to your patients in the standardized patient encounters. You can do this by avoiding medical jargon and specific terms. Try to use simple language that the patient will understand. Now, it's important to use this simple language in a genuine way so that it doesn't come across as condescending, but you want to explain it to the patient without using medical dictionary terms or terms that you learned in medical school, and try to focus on things that a lay person may understand. A very effective way to do this is to ask a patient to teach you something back after you've explained it to them. This is a great way to ensure that they've understood what you've just conveyed to them. When doing your educational material or providing education to the patient, of course, you want to address the specific concerns and questions that may have brought them in or they may ask you now. Ensure the information you give them is tailored to these issues. This shows the patient that you're attentively listening to them and that you care about why they're here. Describe your planned next steps, whether it's imaging, lab tests, physical therapy. Explain to the patient what the goal of these are and how they can help come to a diagnosis and/or a treatment. and explain why the different tests you're ordering may be recommended, the reasoning behind the tests you're ordering, or the imaging you may be recommending. Patients really appreciate when physicians take the time to understand why they need to have tests done. This can help make the patient feel like more of an ally and more of a member of the team, helping them to make decisions and take ownership of their health. You always have to strive to support the patient's emotions that they convey within the standardized patient encounter. Some ways you can accomplish this are to both elicit and acknowledge their emotions when they come up. Pay attention to things like body language, facial expressions, tone, and word choice. These may be important clues about how the patient is feeling. It's important to acknowledge these emotions and ask the patient to tell you more and share about their feelings and their reactions to what's going on to them. This shows the patient that you're paying attention and you're being empathetically involved with their life. It's important to validate the patient's concerns and legitimize the emotions. So for example, the example I gave earlier about the job loss or job uncertainty, it's important to say something like, I can understand why that would be so scary. Show the patient that you can understand why they feel a certain way and that they are legitimized for having those emotions, whether it's fear or anger or whatever it might be. You want to use supportive statements, show the patient that you're going to be there for them in an appropriate way, of course. And you want to use empathetic statements and body language throughout the patient encounter. You want to communicate to the patient that you care about them and you're trying to put yourself in their shoes and imagine how challenging and difficult this must be for them. Overall, I want you to remember that each standardized patient encounter, it's really a valuable learning opportunity to improve your clinical and your communicational skills. It might not always feel realistic and it might not always feel like it's for your benefit, but this learning experience, not only the encounter itself, but the feedback from the standardized patients and learning about their perspective can help you so much in your future clinical practice and your clerkship rotations. Try to approach the SP's feedback with a genuine interest and open-mindedness, and try to incorporate their recommendations or concerns in your future encounters. Standardized patients can have very valuable input that can help you refine your clinical and relational skills and help you cultivate more meaningful relationships with your patients in the future. If you apply these tips, I can promise you're going to succeed, not only in your standardized patient encounters, but also in the real world. I'm Dr. Matthew Momjian, and this has been a Med School Moment brought to you by MedSchoolCoach. If you want more personalized advice, please scan the QR code on your screen or click the link in the description to book a free consultation with our enrollment team. Your path to becoming a physician is important to us.